the vaccine mandate in healthcare settings, and an Ontario judge has just issued an injunction. Sounds temporary, but injunction that says these group of healthcare workers can stay at their job for now and not have to succumb to the vaccine mandate. Brock, again, it's temporary. It's going to be reassessed in a few days. Is there hope, do you think, that this mandate will stay? Do you think these healthcare workers should just get on with the program? What are your thoughts?
You've got two different problems here. One is the shortage of hospital staff. You don't have enough doctors, you don't have enough nurses, you don't have enough allied support workers. I think across the board, we're already short-staffed. Forcing people to be vaccinated to work is going to make it further short-staffed. British Columbia is already there. I think it's today. We're coming into effect here in BC that all medical and healthcare professionals are going to be required. They had their extension for another 30 days, but I think we're going to have a healthcare crisis here as the remaining folks don't have the vaccines.
Okay, Hannah?
Absolutely, I totally agree. If we're living in a pandemic, then the last thing we should be doing is firing healthcare staff, because here in Canada, especially in Ontario where I live, we've had problems with our healthcare system with understaffed departments for a very long time. And especially during the time of COVID, a lot of our healthcare workers have been taxed beyond their limits. I mean, there's so much, dealing with COVID patients and being tested all the time, all these different types of things. Now the mandate's coming down, a tremendous amount of stress on them. And it's not sending a good message to people who are considering going into the healthcare profession. Do you want to go through this type of stress on top of your job? And I mean, I don't really recognize Canada in many ways, to be honest, right now. Like, we do have a charter and we do have a constitution still on paper, and it is illegal for workplaces to not allow medical and religious exemptions. Leave the few people alone who don't want to get it and get on with the show and focus on caring for the patients, because they're the ones who are most important.
It's a good point. Recent statistics show that well over 80% of Canadians who are eligible have been jabbed with the COVID vaccine. So, clearly a lot of people are. If there's a handful who are in the healthcare setting, why go after them? Again, I was particularly surprised because there have been really not very many, if any, positive rulings from the judiciary on any COVID matters. So that was a pleasant surprise. We'll see what happens. It's going to be heard in a few days, so we'll see what happens to that. Speaking of vax mandates, let's talk about the House of Commons. So this is interesting. The House of Commons, through a small subset committee, has now decided to force a vaccine mandate on all its members. If you are an MP and you want to sit in the House of Commons physically, then you will require to furnish proof of vaccination. You'll be required to be vaccinated. So in one way, I'm thinking, okay, this is good, because if you people, like the elected politicians, are mandating the vaccines, then you better have your own mandate. But on the other hand, I'm not one for these mandates, and I'm thinking they don't have a right to kick these MPs out of sitting. I don't know, Brock. It's an interesting toss-up. In one hand, I feel one way, on the other hand, another. Is this going to hurt democracy?
I think we have a few things hurting democracy here. One, the parties aren't in agreement on whether to go back to the full House or continue to allow the virtual sittings. I think with the virtual sitting, eventually, if we've made that permanent, we get better candidates for public office. It's a slog dragging yourself to Ottawa 30 weeks a year. I think that's a big problem. But I think on the issue of the mandate, the real challenge is the poor messaging they have. It came out of a small, obscure committee that isn't as public as many of the other parliamentary committees. It wasn't in front of the entire House. There was no public debate. There's a lack of consultation. I think across the board, it's a mess. I think it's a bigger problem for the Conservatives than the other parties, but there doesn't seem to be a clear path forward for the Parliament as a whole or the Conservative Party on this.
And why is this a problem for the Conservatives more, Brock?
The Conservatives tried to take a balanced approach and got attacked from both sides. And I think that's been hurting them from midway through the federal election when it became a bigger issue again.
Okay, I thought maybe there were just maybe a higher percentage of unvaccinated MPs, perhaps, amongst the Conservatives. Who knows? Hannah, what is your take on this? Is this good for democracy? Is this good for representative democracy in Canada?
No, I don't think it's good for representative democracy at all. And like the point that you made that, if these people are going to support, if our MPs are going to support mandates like this, then they need to be willing to abide by them. However, that's not across the board. Not all MPs are in favor of these types of mandates. Not only are their rights going to be violated, but also this mandate is for all staff members, for anybody basically who wants to set foot in Parliament or in the Parliament buildings, including guests. So what does it say to someone who's a Canadian and for whatever reason they are not comfortable getting this vaccine, that they're not welcome in the center of democracy in their country?